A deadly outbreak of the flu is sweeping across several states. The Centers for Disease Control reports some of the most severe cases are in 20 states. Most of the H1N1 strain of influenza, which caused a worldwide pandemic 4 years ago. Brandon Scott reports from hard-hit California.
These tents in front of San Jose's Regional Medical Center are usually set up for disasters. Now hospital staff are preparing them for a surge of patients suffering from the flu.
We're using them to kind of isolate those patients from the other patients.
California's flu season is off to an aggressive and deadly start. Statewide, the flu is blamed for 7 deaths. Health officials are investigating 28 more as possibly flu-related.
What brings you to the hospital today?
Brooke Villacana brought her 2 young sons to an emergency room in Orange County. They've had fevers, coughs, and congestion. She fears it's the flu.
Just scary being a mom and with 2 little ones that are super sick.
This current flu outbreak stretches across the country. According to the Centers for Disease Control, California is one of 35 states with widespread influenza activity. 12 additional states are battling regional levels of flu. The predominant virus is the H1N1 strain, last seen in the 2009-2010 flu season. Known as swine flu, it killed at least 150,000 people worldwide. It hits kids and young adults the hardest, a group usually at lower risk.
There was a bit of a panic surrounding H1N1 last time around. Is that panic justified? Is it that bad of a strain of flu?
I think people underestimate what flu can do to people. People who truly have influenza are sick, they feel rotten, and some die. It can be a very devastating disease.
This year's flu vaccine can protect against H1N1, and doctors recommend vaccinations for everyone ages 6 months and older.
The CDC estimates that just 40% of Americans have gotten a flu vaccination, meaning more than half the country is still at risk during this current outbreak. For CBS This Morning Saturday, Brandon Scott, Los Angeles.